I've always been active. I played football in college, I played a lot of basketball. I started aging and I got into golf. I lived to golf. However, golfing was getting to be pretty difficult because of the knee problems I had. I had several surgeries and I was finding it difficult to walk up and down hills when I was golfing. I couldn't carry a bag anymore. I had talked to a couple orthopedic surgeons. Both of them recommended knee replacements. I didn't want to have my knees replaced. I wanted to continue to be as active as I could because I have a background in graduate school in exercise physiology and biomechanics. I know the problems that can come with knee surgery. I know all about scar tissue. It doesn't have blood vessels in it. It's very hard to keep it flexible. You lose range of motion. So I looked around for alternatives. I figured there had to be something out there, and I found Regenexx on the internet. My thought was, what do I have to lose? I go to Regenexx, I have some stem cells, which were my stem cells, placed into my knee, see if I can have some cartilage grow. If it doesn't work, I could always go back and have my knee replaced. And it worked. It was awesome. I was a little bit skeptical because of my background, but I flew out to Colorado. I had bone on both knees. There's no surgery involved. It was all needles. It was removing some blood cells from me, getting the stem cells out of that and putting it in. And the rehab was kind of non-existent. It was a 6-week thing. The results are remarkable. My pain went away. I was having trouble walking downstairs and walking upstairs. That went away. One of the amazing things was John Schultz said to me, "You've got a loose collateral ligament." I knew that I had a loose collateral ligament and that my knee would slip every now and then, and he said he could tighten it up, and I really didn't believe that. I was convinced, I was thinking from my physiological background, how can you do this? You can't do this. And he talked about building a bridge and thickening it. When I went back, and we looked at it on the ultrasound, he showed me what he did, and it was remarkable. What he really did was he filled in the gap that was caused by the stretching of my collateral ligament, and it tightened it, made it stronger than it was before, and that was why my knee wasn't slipping anymore. I'm an executive with an international medical company. I've worked with doctors all my life. I've had a lot of people who have talked to me about this. I'm going to say at least a dozen people. 2 of them have gone ahead and done the procedure, and they're elated with the results. One is a professional hockey player. The other 10 or 11 people that I talk to all tell me the same thing. They all come back and they say, well, I talked to my doctor, and my doctor said, it's not going to work for you. And I keep telling them the same thing. For anybody who's looking at this procedure, if you're going to talk to an orthopedic surgeon, he's going to tell you not to do this. He's making money. It costs somewhere between $20,000 and $36,000 to have a knee replaced. Especially if they're going to do 2 of them. That's a lot of money. He's going to get 50% of that money. He doesn't want to give up that money. Now, there are a lot of good doctors and there are a lot of bad doctors. But even a good doctor, they're still in this to make a living. Who in his right mind would recommend you go out and do something and take away his job? It's not going to happen. So my attitude with everybody I talk to is, what do you have to lose? Just a few $1,000s. I mean, it really isn't anything. Go and have it done. If it doesn't work, you can have your knees replaced. But I think you're going to find out, like I found out, this is absolutely remarkable. If I have any kind of problems in the future with any of my joints, I'm going the stem cell route because it works.